Hi, everyone. My name is Matt Richard, and I am the manager for the Homeless Management Information System, or HMIS, for the Colorado Balance of State Continuum of Care. In this tutorial, we are going to walk through how to complete our updated Balance of State HMIS intake paperwork, which we are releasing in December of 2023. Our new intake paperwork has been updated in accordance with the fiscal year 2024 HMIS Data Standards, which were released by the Department of Housing and Urban Development, or HUD, and went into effect on October 1st of 2023. In this tutorial, we're going to walk through the best practices associated with completing the updated intake paperwork, but we would note that entering data directly into HMIS is also an option if you'd prefer to save a step and not use the paperwork we offer. And while we will do our best to explain the concepts, terminology, and associated questions HUD expects us to collect for HMIS in each of the sections we review, we know you may have additional questions after watching the tutorial video or after you start to collect paperwork with clients out in the field. If you do have any questions, please feel free to reach out to us via email at dola_bos_HMIS@state.co.us. Even if you don't use HMIS yourself, please feel free to reach out. We're happy to answer any questions that you might have. In HMIS, there are different data collection requirements for adults over the age of 18 and children under the age of 18. To account for these data collection differences, we have one set of intake forms for adults, totaling 4 pages, and a one-page intake form for children. We have also added a version number to the bottom of each page of our forms to help ensure the correct version is being used. The version we are releasing in December of 2023 is FY2024 V1. We have designed our updated forms in a way that allows you to use them for any HMIS project type you need to capture data for. Because of this, there are a small number of questions included in the paperwork that only need to be collected for certain project types, but not all. We will review each of the questions this applies to as we move forward through the tutorial. We also have an optional one-page form for any heads of household who would like to share the reasons or contributing factors they feel led to their current experience of homelessness or housing instability. This helps ensure we're able to hear directly from the people we serve about the challenges and barriers they've faced in relation to remaining stably housed, which we analyze and use to help advocate for additional resources or intervention types. For the people who would like to share, please select as many of the responses they provide from the available options listed in this form. Before we review our updated forms in more detail, we wanted to go over 3 response options that are available for almost every question in HMIS and when it is appropriate to use each option. The first is client doesn't know, which should be used when a client does not know the answer to a question they're being asked. In our paperwork, we have shortened this option to read don't know due to space constraints. Next is client prefers not to answer, which should be used when clients would prefer not to provide a piece of information for a question they are being asked. We've shortened this option in our paperwork to read refused, again due to space constraints. The last option is data not collected, which we did not include as an option in our paperwork, as this option should really only be used when a client is not asked a question. If you're doing HMIS data entry on behalf of another staff member and get to a required question that has been left blank in the paperwork, you can select data not collected as the value in HMIS in order to save that screen. And it's also important to note that all of these response options are valid and can be used in HMIS for clients as needed, unless that question is tied directly to program eligibility. For example, for the Department of Veteran Affairs and their SSVF, or Supportive Services for Veteran Families programs, they actually do require that a full Social Security number be collected for the head of household active duty veteran in order to determine program eligibility. The last thing to note is that the use of client doesn't know, client prefers not to answer, and data not collected might be appropriate for the use case that you are collecting data for. But each of these response options are viewed by HUD and other federal reporting partners as missing data and will show up as data quality issues in any federal reports you may need to run. With those housekeeping items out of the way, let's begin reviewing our updated intake forms. We will primarily focus on the adult intake forms in this tutorial, as those forms contain all of the same fields that are available in the form for children. We'll review the forms section by section, beginning with client name. While collecting information about names from clients is generally fairly straightforward, there are a few considerations we want to be sure to review. For HMIS, we need to collect both the client's name and the associated quality of the name that has been collected. To be considered a full name reported for HMIS requires that a first and last name have been provided by the client. It's important to note that unless the funder requires legal first and last names as a part of determining program eligibility, clients are able to provide their preferred first and last name and have it be considered a full name reported for name quality, even if their preferred names do not match their legal documents. An example of a funder that does require a full legal name for program eligibility is the Department of Veteran Affairs. If folks are using preferred names and not legal names, you can explain to them that from a care coordination standpoint, it can be valuable to document their legal name, particularly when it comes to helping them apply for mainstream benefits, but this should always be up to the client, particularly in cases where their legal name might be their dead name. HMIS records are not expected to include dead names or otherwise unused legal names unless permission is provided from the client or it is required by the funder. Really, the take-home message here is that most of the time, the first and last names provided by the folks you're working with will align with their legal names. But if they do not, and if the funder you're collecting data on behalf of does not require full legal names, it's completely fine for clients to use their preferred name and for that to be considered a full name reported for the name quality in HMIS. Let's complete a quick example together using our updated intake forms. I'm working with a client and I ask for their name. They inform me their name is Jimmy McGill. I ask a quick follow-up question to see if they may have gone by any aliases or other names before, and they inform me that they've also gone by the alias of Saul Goodman in the past. In our updated paperwork, we've left the client name section quite long in order to be able to document aliases or other names folks may have gone by, as long as they give us permission to document that information. If you remember from the previous slide, we've collected a full first and last name from the client, so we're able to select full for the name quality for HMIS. Let's take a quick look at a client profile screen in HMIS, where this identifying information collected on our paperwork is ultimately entered. You can see that there are dedicated last name and first name fields where we can enter the preferred names for clients or legal names if it's required by the funder. At the bottom of the screen, we also have an alias field where we can enter other names clients either currently go by or have gone by in the past. And in HMIS, it's possible to search for clients using their first name, last name, or aliases, which is why it can be important to ask follow-up questions when completing intake paperwork and documenting those aliases, again, as long as we get permission from the folks we're working with. You may have noticed that there's an option for partial for name quality and be wondering, what does a partial name correspond to for HMIS, or when would I use that? Really, it's just when you're only able to get a name other than the full first and last name provided by a client. Typically, this can be a placeholder name used by outreach workers, or maybe a de-identified code name that is being used to protect the personally identifying information of the participant for security reasons. As a quick example, if you were an outreach worker and the first time you came into contact with a client, you were only able to collect their first name, but the interaction you had happened at 10th Street, you might enter a placeholder value of Rick 10th Street and select partial for the name quality for HMIS. In HMIS, you have to enter a value for both first and last name in order to save a client profile. So it can be a good idea to have a standardized naming convention for the scenarios I described above in order to be able to find that profile again moving forward. Up next, we have Social Security Number, or SSN, which we collect in order to support the unique identification of each person being served in HMIS. This also helps us prevent duplicate records or client profiles in our system, which can have negative impacts on care coordination efforts and in being able to see a holistic view of all the interactions and care teams a person might be working with. Just like with names, we need to indicate the quality of the SSN we've collected, with a full SSN reported really just meaning that we've got that complete and valid 9-digit social security number. If we're only able to collect a partial social, maybe the last 4 digits, we'd select partial for the SSN quality and enter the last 4 in that last section of the SSN line. And finally, If anyone is reticent to share their social security number, we try our best to explain that we're collecting this information, again, to prevent duplication and for care coordination, in order to help ensure that we can help get these folks connected to any mainstream programs they may be eligible for, many of which do require a full or valid SSN. Collecting this information on the front end can help us expedite these applications. And just as a quick example, if we were only able to get that last 4 digits of a social, we'd toss that in at the end of the social security number line, and we'd select partial there in the paperwork. Moving on, we have date of birth, which also helps support the unique identification of each person being served in HMIS, which prevents duplicate records in our system. And just like with name and social security number, date of birth also has an associated quality that we have to indicate for the information that we've collected, with a full date of birth reported, really meaning that we've got that complete and valid date of birth for the participant. A partial date of birth could be entered for any other value that we've collected that's not that complete and valid date of birth. Maybe it's the approximate date of birth if a person's only willing to divulge the year that they were born. If we do get that full date of birth, we'd enter it into the appropriate section in the paperwork and indicate the full date of birth quality as well. For folks who are unwilling to provide their full date of birth, but are willing to provide the year they were born, we'd use a placeholder date value for the month or day in order to be able to save this value in HMIS. So for example, if a person is willing to divulge they were born in 1986, we'd need to use 01 for the month and 01 for the day in order to capture that in HMIS. If they're willing to provide the month and the year, but not the day, maybe let's say August, we'd put 08/01, 1986. The next section is to be used by the agency staff member who's completing the intake paperwork. And really this helps staff members who are doing data entry in HMIS know who they should reach out to if they have any questions about the paperwork they've received. So you enter your name, you enter your agency name, and you enter your contact information, maybe your email address and your phone number. And then you'll enter the project name if you know it, which that will depend on the initiative you're collecting data for. If you're only collecting paperwork offline and we'll be handing this off to someone else who will do the HMIS data entry, you can ask them what you should put for project name, or you could just use a generic term like coordinated entry if that's what you're collecting the paperwork for. And then the intake date is just the date you helped complete this paperwork, and it generally equates to the project start date in HMIS. The next section in our paperwork asks for details about the household composition, and for heads of household, there's also a new data element that asks whether they need any translation assistance. And really, relationship to head of household helps us identify one person within the household that all other household members are associated to, kind of like the main point of contact for the household. The values that can be selected for this are self, or head of household's child, which includes adult children, head of household's spouse or partner, head of household's other relation, like a cousin or an aunt or an uncle, and then other non-relation member if none of those other options make sense. And really, these relationships to the head of household help us determine the types of households that we're serving. Are we serving a single adult household, or a multi-member adult household, or a household that has both adults and minor children? There can be one and only one head of household designated per household per enrollment. And really, this designation is up to the clients in the household unless there are specific requirements or criteria by the funder you're collecting data for that necessitate one person being designated as the head of household. So for example, for the VA and for their funded programs, they generally require that an active duty veteran be the head of household. Outside of situations like that, it's really up to the people that are in that household to designate who the head of household is. So if you mark self for head of household, there is that new translation assistance needed data element that asks, does this household need any translation assistance? And if they do, you'd indicate yes. And if you indicate yes, you then need to indicate in the language line item what language they need translation assistance with. Up next, we have a section that includes additional demographic-related questions about clients. The first is gender, which is a select all that apply field. It's important to always ask clients for their gender information and not to guess or make assumptions. So you'd simply select the options that the client reports for their gender. If they report a different gender identity that's not listed in the other values, there is an option for that where you can write in the identity that they've reported to you. There's also a new optional data element as of October 1st in HMIS for pronouns for the clients that would like to share that information. This field is single select. So if your client reports pronouns that are different than those that are listed, you could click the other pronouns and you could enter those details in that line item. We'll move on to race and ethnicity, which has been combined into one overall field this year in HMIS. Previously, race and ethnicity were collected separately. Now they've been combined into one field. So this is also a select all that apply field. So you'd work with your client and indicate on the form the races and ethnicities that they identify with. There's also an additional race and ethnicity reported option. If they identify with a race or ethnicity that is not listed, you could check that box and enter that detail in that provided line item. And lastly, there's veteran status, where folks can indicate whether they have ever spent time in the United States Armed Forces. There are additional veteran status questions in HMIS that may need to be collected for VA-funded programs, like dates of service, theater of operation, discharge status, but those fields are not required for HMIS outside of those VA-funded programs. So our default forms just have the overall yes, no, don't know, refused values. At the bottom of page 1, we'll come to the disabling condition and disability type section. And before we proceed through how to complete this section, it's important to understand HUD's definitions and expectations associated with disabling conditions. So according to HUD, a disabling condition is when one or more of the following are present: a physical, mental, or emotional impairment, including an impairment caused by alcohol or drug abuse, post-traumatic stress disorder, or brain injury that is expected to be long continuing or indefinite in duration and will substantially impede that individual's ability to live independently, or could be improved by the provision of more suitable housing conditions. It's important to remind folks that having accurate information about their disabling conditions can help ensure we're able to connect them to resources and programs they may be eligible for down the line. Totally understand that this is sensitive information, particularly about the alcohol or drug abuse issues that might be present, but explaining the why that this behind why this information is being captured and how it helps ensure we're able to prioritize folks for resources that can best meet them and their needs is an important detail to go over. It's also important to note that it's not necessary to provide documentation of the disabling conditions folks may have at the time of the intake, but that again, because certain funders may require that documentation for their eligibility purposes of their programs down the line, again, just getting this information as accurate and completely as we can is really important. Let's take a moment to review each of the disability types HUD asks us to collect information about for each person we're completing intake paperwork on. The specific disability types include physical disabilities, developmental disabilities, chronic health conditions, HIV or AIDS, mental health disorders, and substance use disorders, including alcohol abuse, drug abuse, or both alcohol and drug abuse. I won't read each of the definitions HUD provides for each of the specific disability types, but I would encourage you to please pause the tutorial video at this point and review each of these definitions to make sure you're able to understand and explain these concepts to the clients that you're working with. With that in mind, let's begin working through the disabling condition and disability type section of the paperwork. Before answering the overall disabling condition question on the far left, it may be a better strategy to start by asking the person if they have any of the specific disability types listed in the middle section, given all the nuance and context associated with what HUD considers a disability. So as we reviewed on the previous slide, HUD asks us to first document whether a person has a specific disability type before then asking if that disability type is expected to last indefinitely or is impacting their ability to live independently. So for example, let's say our client had a broken leg. That is a physical impairment, so I would check yes for having a physical disability. But is that disability going to be long-term? and impact that client's ability to live independently. If it's a broken leg that's expected to heal and from that client will recover fully, that's probably not going to be considered a long-term disability that's going to last indefinitely, right? So I'd pick yes for the overall condition for physical and no for is that disability type expected to last indefinitely. Now, if this leg was broken in a way that this is going to be an issue that this client has for the rest of their life, an issue they're always going to have to deal with and navigate, then I would have picked yes, but just kind of going over that distinction with you. As another example, my client Jimmy indicates he has a heart disease issue, which is a chronic health condition according to HUD data standards. So I'd select yes for that chronic health condition. And that heart disease issue that he has is going to last indefinitely and will impact his ability to live independently. So I'd also select yes for that subsequent question on the right. Now, there are two exceptions for when having the disability type will not necessitate asking that secondary, is the disability expected to last indefinitely question. And those are developmental disabilities and HIV or AIDS. And that's because if you have either of those conditions, HUD infers that those are long-term indefinite disabilities due to the nature of those conditions overall. So asking that secondary question for either of those disability types is not applicable. By asking the person whether they have any of the specific disability types, and for those that they do have, indicating whether those conditions are expected to last indefinitely and will impact their ability to live independently, we are then able to verify their overall disabling condition status on the far left-hand side of the paperwork. And there is a bit of logic that's needed in order to answer this question. And really it comes down to, do they have a yes value for either the developmental disability or HIV/AIDS disability? And if they do, those questions, those disability types, do not have that secondary, is the disability expected to last indefinitely question due to the nature of those conditions. So if they have a yes for either developmental or HIV/AIDS, we're able to mark yes for the disabling condition. For all the other disability types, we would need at least one yes for them having that disability type, and at least one subsequent yes value for that disability being expected to last indefinitely, and that it will impact their ability to live independently. If either of those criteria are met, we're able to answer yes to the disabling condition question. And if the person didn't have any of those disability types or didn't match any of the criteria we just reviewed, having no values or don't know or refused values, we'd really just mark no as the overall disabling condition status for that person. And hopefully this section has made sense, but if you have any questions or concerns about how to accurately document the disability types and overall disabling condition status for the people that you're working with, please feel free to reach out to our team. This section can help folks in coordinated entry programs be prioritized for resources that require at least one household member have a disabling condition. So it's important that we capture this information as accurately and completely as possible. Let's move to page 2. We will begin by making sure we also document the client's name and the date of the intake at the top of the page to ensure all of the information being collected can be attributed to the person you are collecting it from, which can be really helpful if you're completing the forms and giving them to someone else who will do the data entry in HMIS on your behalf. The next section of the paperwork is about prior living situations, which we collect for all adults and heads of households. This is really asking, where did the client sleep the night before the intake was being completed? And it's used to identify the type of living situation and the length of stay in that situation immediately prior to the intake. You really only need to complete the relevant section of the intake paperwork, A for literally homeless situations, B for institutional situations, and C for temporary or permanent housing situations, depending on the living situation the client indicates to you at the time of intake. Let's review all of the different types of living situations, starting with literally homeless situations, which include places not meant for human habitation, including vehicles or anywhere outside, emergency shelters, including hotels or motels that are paid for with emergency shelter vouchers or host home vouchers, or safe havens. Institutional situations include foster care homes or foster care group homes, hospitals or other residential non-psychiatric medical facilities, jail, prison, or juvenile detention facilities, long-term care facility or nursing homes, psychiatric hospitals or other psychiatric facilities, or substance abuse treatment facilities or detox centers. Temporary and permanent housing situations include any of the following: transitional housing for homeless persons, including homeless youth, residential projects or halfway houses with no homeless criteria, hotels or motels paid for without emergency shelter vouchers, host homes, staying or living with friends or families, whether it's in their room, apartment, or house, rental by clients with no ongoing housing subsidy, rental by clients with ongoing housing subsidy, in which case you'd also need to document the type of subsidy they were receiving, and then owned by client either with an ongoing housing subsidy or with no ongoing housing subsidy. Before we walk through some practical examples, please keep the following considerations in mind when you're collecting information from clients about their prior living situation. The project type you're collecting information for helps inform the specific questions that need to be asked. For emergency shelters, street outreach, or safe haven projects, you're always going to ask the exact same questions, regardless of where the client slept the night before, because the expectation for clients enrolling in those project types is that they are experiencing an episode of homelessness. For example, if a client is having an intake done because they're needing to stay at your overnight emergency shelter, they're experiencing homelessness, regardless of whether they stayed with a family member or a friend the night before. And for our emergency shelter and street outreach worker friends, please do your best with having folks answer these questions. It's expected that the information you're able to obtain may be ballpark estimates from clients, and that's okay. For the other project types we have in HMIS, including coordinated entry, day shelter, transitional housing, homelessness prevention, services only, and permanent housing, which includes permanent supportive housing, rapid rehousing, and other permanent housing, the questions that we ask clients about their prior living situation will be determined by that overall living situation and the length of stay they spent in that living situation, particularly if it was not a literally homeless situation. And this is because certain project types like day shelters and services only may not exclusively work with folks who are experiencing homelessness at the time of intake, while other project types like permanent supportive housing may actually have eligibility requirements that require clients being enrolled be experiencing homelessness at the time of intake. For these project types, additional questions are needed in order to determine whether the client is matching HUD's definition of experiencing homelessness at the time the intake is being conducted. Let's review each of the prior living situation sections in a bit more detail, starting with Section A for literally homeless situations. Most of the folks we serve in HMIS are entering our projects from literally homeless situations. In this example for my client, Jimmy indicates he was camping outside in a tent. So I'm going to check place not meant for human habitation in that first section for where did the client sleep the night before entering the project. After documenting the literal homeless situation, we then need to indicate how long the client spent in that living situation. So Jimmy tells me he spent 2 weeks in the tent he was staying in, so I select the 1 week or more, but less than 1 month option. We then need to indicate the approximate date the current episode of homelessness started. In order to document when the current episode of homelessness started, we first need to define what HUD considers as an episode of homelessness. And really what is being asked is for the length of continuous time clients have spent in places not meant for human habitation, emergency shelters, or safe havens. We also need to be able to understand what HUD defines as a break-in homelessness. And a break-in homelessness occurs when either a client has spent either 7 continuous days or more in a housing situation, maybe staying with friends or family, or 90 continuous days or more in institutional situations like jail or prison or hospitals. If either of those things happen, it's considered a break in a person's episode of homelessness. Here's a quick example of this in action. So Jimmy informs me he spent the last 2 weeks camping outside. Before he was camping, he says he stayed in an emergency shelter for the 2 weeks before that. And before entering the emergency shelter, he was staying with a friend for 2 weeks. To ensure we're able to accurately capture the date the current episode of homelessness began, it can be helpful to make a quick timeline working backward from the date of the intake. So in our example, the date of the intake was December 3rd. and Jimmy reports that he's been camping outside for 2 weeks before that. So 2 weeks before that is November 19th. 2 weeks before that was November 5th, and that's when Jimmy reports that he was in an emergency shelter. And 2 weeks before that would be October 22nd, when Jimmy says he was staying with his friend. As we reviewed earlier in the tutorial, stays in housing situation, including staying with friends, of 7 days or longer is considered a break in homelessness. So Jimmy's 2-week stay with his friend was longer than 7 days, so his current episode of homelessness began on November 5th when he started staying at an overnight emergency shelter where he's been experiencing homelessness ever since. Navigating back to the approximate date this episode of homelessness started field, we'd enter 11/5 of 2023. The next question asks for the number of separate times or episodes of homelessness the client has had in the past 3 years. Let's use what we just learned about episodes of homelessness and breaks in homelessness in order to answer this question, including asking the client about their history of experiencing homelessness, reviewing the types of living situations they've had in the past 3 years, and making sure we're able to determine if they've had any breaks in homelessness, which again entails having 7 days or more of continuous time in housing situations or 90 days or more of continuous time in institutional situations. Asking questions about a person's history of experiencing homelessness and the types of living situations and the lengths of stay they've had in those living situations is necessary in order to answer the number of episodes of homelessness they've had in the past 3 years. So in our previous example, we were able to determine the current episode of homelessness for Jimmy began on November 5th when he entered the emergency shelter. Previously to that, he was staying with his friend for 2 weeks. But since we need to look back 3 total years for HUD and what they expect for answering this question, we also need to ask follow-up questions. Before you were staying with your friend in October, what was your living situation? Have you experienced homelessness before that? And with Jimmy, he says before staying with his friend, he was stably housed and he's got no other experiences of homelessness. So for my example, there's really only one episode of homelessness that I can document for Jimmy in the past 3 years. But the need to ask these questions and to document those living situations and the length of time in those living situations is really needed in order to be able to determine the number of episodes of homelessness. Navigating back to the paperwork, I'd select 1 time for the number of times or episodes Jimmy has experienced homelessness in the past 3 years. The final question asks for the total number of months the client has spent in homeless situations in the past 3 years. And determining the number of months of homelessness in the past 3 years also requires asking the client about their history of experiencing homelessness. So we can count the cumulative number of months of homelessness they have in the past 3 years. It's important to note that partial months count, including the current month. So for my example with Jimmy, he was homeless in both November and December of 2023, which would correspond to 2 months of homelessness because his episode of homelessness occurred both in November and December. Navigating back to the paperwork, I'd select 2 months as the total number of months of homelessness for Jimmy in the past 3 years. Let's move on to Section B for clients whose prior living situation was an institutional situation. How to answer the questions in Section B for institutional situations is going to depend on the HMIS project type you're collecting data for. And that's because, as you remember from earlier in the tutorial, for emergency shelter, street outreach, and safe haven projects, we're always going to ask the exact same questions, and those questions are the exact same as the ones we just reviewed for the literally homeless situations in Section A, which are: where did the client sleep the night before entering the project? How long did they stay in that prior living situation? Skipping over that middle question, which is more needed for the other project types, and then asking, when did the current episode of homelessness start? How many separate episodes or times has the client experienced homelessness in the past 3 years? And how many total number of months has the client experienced homelessness in the past 3 years? For all other HMIS project types, like coordinated entry and all types of permanent housing, the length of stay in the prior living situation helps us determine whether the client is matching HUD's definition of experiencing homelessness at the time of the intake. In my example, let's say I'm completing coordinated entry intake paperwork with Jimmy, who tells me he was in jail the night before. The next question asks, how long was Jimmy in that prior living situation, or jail for our example? And Jimmy indicates he was in jail for 60 days, which is over 1 month but less than 90 days, so I'd select that option. The next question asks if that length of stay in the institution was less than 90 days, and if it was, whether the client was in a homeless situation on the night before they entered that institution. And that's because if you remember from earlier in the tutorial, lengths of stay in institutional settings that last for 90 days or more are considered a break in homelessness. So really these questions allow us to determine whether a person is matching HUD's definition of experiencing homelessness at the time of the intake, even if their prior living situation on the night before the intake isn't a literal homeless situation. Answering the first part of this question is tied to the value you just collected for the overall length of stay. Since Jimmy said he was in jail for 60 days, well, 60 days is less than 90 days, so I'd select yes for the first part of the question. Since we answered yes, we'd move on to the next part of the question, which asks, on the night before this person entered the institution, were they in a homeless situation? Like a place not meant for human habitation, an emergency shelter, or a safe haven. If the client was in a homeless situation on the night before they entered the institution that they stayed in for less than 90 days, we'd select yes for that next part of the question, and then we'd work to complete the remaining 3 questions using the guidance we reviewed in Section A. The questions are the exact same. We just first needed to verify that the client was matching HUD's definition of experiencing homelessness at the time of the intake, which for institutional situations is tied to whether or not they stayed in that institutional situation for less than 90 days. And if the client was not in a homeless situation on the night before they entered an institution they stayed in for less than 90 days, we'd select no, and we wouldn't need to answer any of the remaining 3 questions. In HMIS, we'd actually be prevented from answering these questions as they wouldn't even appear in the interface because of the values that we collected on the front end of this section. And this would also be true if we had selected no for the overall was the length of stay in the institution less than 90 days question. So if my client stayed 90 days or more in an institution, I'd select no for the length of stay less than 90 days question. I wouldn't need to answer that second part of the question, and I wouldn't need to answer the remaining 3 questions because we've not matched HUD's definition or expectation of an experience of homelessness at the time of the intake. Section C would only need to be completed when a client had a prior living situation that was either a temporary or permanent housing situation. And just like with Section B, the project type you're capturing data for will determine which questions you need to ask. So for emergency shelter, street outreach, and safe haven projects, again, the questions you ask are always the same. You ask those same 5 questions, really the questions that correspond to Section A. Even though the living situation may not be a literal homeless situation, they're enrolling into a project type where their experience of homelessness is inferred due to the enrollment they're receiving. For all the other HMIS project types, again, like coordinated entry and all those permanent housing projects, the length of stay in the prior living situation helps us determine whether the client matches HUD's definition of experiencing homelessness at the time of intake. So in this example, let's say Jimmy was staying with a family member on the night before having his intake completed. I'd select staying or living in a family member's room, apartment, or house. We'd then document the length of stay Jimmy spent with his family member, and in my example, Jimmy indicates he's been staying there for the past 4 days, so I'd select 2 to 6 nights. The next question asks if that length of stay in housing was less than 7 days, and if it was, whether or not the client was in a homeless situation on the night before entering that house situation. And that's because if you remember from earlier in the tutorial, lengths of stay in housing settings that last for 7 days or more are considered a break in homelessness. So really what these questions are doing is allowing us to determine whether a person is matching HUD's definition of experiencing homelessness at the time of intake. Again, even if their prior living situation on the night before the intake isn't a literal homeless situation. Answering this first part of the question is tied to the value we just collected for their overall length of stay in this house situation. And in my example, Jimmy said he stayed with his family member for 4 days, and 4 days is less than 7 days. So yes, he did stay less than 7 days. Since we answered yes, we move on to the next part of the question, which is asking, on the night before entering that housing situation, was the client in a homeless situation? And again, really, a place not meant for human habitation, an emergency shelter, or a safe haven. And if the client was in a homeless situation on the night before they entered the housing situation they'd been in for less than 7 days, I'd select yes, and I'd proceed through and answer the remaining 3 questions, which we went over how to answer previously in the tutorial. And if the client was not in a homeless situation on the night before they entered that housing setting, we'd select no, and we wouldn't need to answer any of the remaining questions. In HMIS, we'd also be prevented from answering those questions as they wouldn't appear in the interface due to the values we've collected from these initial questions not matching HUD's expectations for an experience of homelessness. And if the person we're working with indicates they've been staying in a temporary or permanent housing situation for over 7 days, maybe 1 week or more, but less than a month, and we select no for the overall length of stay being less than 7 days, we would not need to answer that second part of that question or the remaining 3 questions for the project types that have these dependencies. Hopefully all that makes sense. If you do have any questions about how to complete the prior living situation section, please reach out to us. But just to recap, you only need to complete one section, A, B, or C, which will be determined by the living situation the client indicates they were sleeping in the night before the intake. The next section of our paperwork has 2 questions that are only asked for certain project types. And the first is housing move-in date, which is only to be collected for the head of household who's enrolled within permanent housing projects. And that's used to document the date households have physically moved into housing. And this should be left blank until that happens. So generally that won't occur at the time of intake that the household you're working with is physically moving into a housing unit. It can happen, and if it does, that would be the only time you complete that section. Otherwise, you'd leave it blank. The other question in this section, date of engagement, is only collected for clients who are enrolled in street outreach or night-by-night emergency shelter projects. And really it's used to document the date an interactive client relationship results in a deliberate assessment or the beginning of a case plan. So really that interactive client relationship piece is key here in order to fill this section in. Until that happens, you would leave this section blank. The next section of the paperwork is used to determine whether the person is a survivor of or fleeing from domestic violence, which helps us provide appropriate services which can prevent further abuse. Depending on the specifics and whether or not this person is currently fleeing, it might be appropriate to refer them to a victim service provider. And if this person is a survivor of domestic violence, we also need to document when this experience occurred, using the appropriate response from the provided values. And finally, we document if they are currently fleeing from domestic violence or not. And if they were, it might be appropriate to get them connected to a victim services provider. If you're not sure who the victim services providers are in your region, please reach out to us or to the coordinated entry lead for your region, and we'd be happy to help you make that connection. And if that overall question for whether or not the person is a survivor of domestic violence is anything other than yes, the remaining 2 questions would not need to be answered. Moving on, we get to the income questions, and we begin by asking the client if they currently receive any income from any source. If they did not, we'd select no, and none of the rest of the questions would need to be asked. If they do have income sources, we'd select yes, and then we'd indicate the monthly amount for each of the income sources HUD asks us to collect information about in HMIS, which includes earned income or employment income, unemployment income, supplemental security income or SSI, Social Security Disability Insurance or SSDI, VA Service-Connected Disability Compensation, VA Non-Service-Connected Disability Pension, Private Disability Insurance, Workers' Compensation, Temporary Assistance for Needy Families or TANF, General Assistance, Retirement Income from Social Security, Pension or Retirement Income, Child Support, Alimony or other spousal support, or other income. And while there is an other income source with a required line item that you would need to provide details for, there's almost always a better option than other. So if you find yourself thinking you need to use it, please reach out to our team. As a quick example, let's say Jimmy makes $500 of bi-monthly income from a part-time job he has, and that is his only source of income. I'd begin by selecting Earned Income, but because we're collecting monthly amounts of income for HMIS, we'd need to do a bit of math. So $500 bi-monthly would equal $1,000 a month of earned income. And that's his only income source, so I wouldn't need to check anything else, and I can move on to the next question. The next question that we're going to review is the non-cash benefits section, and whether or not our clients receive any non-cash benefits. Just like with income, if the client did not receive any non-cash benefits, we wouldn't need to indicate any benefit sources in the next part of that question. And if they did receive non-cash benefits, we'd select yes, and then ask the client to verify all of the benefit sources they receive. And for HMIS, we just need to select whether they receive the benefit source. We do not need to track the amounts. The benefit sources we need to track in HMIS include SNAP, or food stamps, Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, TANF Child Care Services, TANF Transportation Services, other TANF benefits, or other non-cash benefits, which will require using the other option and the required line item to indicate the source. I would also say that if you're tempted to use other as an option, please reach out to us. It's almost always one of the other benefit sources and not other. So for my example, let's say Jimmy does have non-cash benefits and he only receives food stamps. I document that real quick in the paperwork. Up next, we have the health insurance section. If the client is not covered by health insurance, we'd select no, and no additional questions need to be asked about the types of insurance they receive. But if the client is covered by health insurance, we'd select yes, and then we would document each insurance source they receive, selecting all that apply in the next section of the form. For HMIS, we would be documenting whether they had Medicaid, Medicare, State Children's Health Insurance Program, or CHIP, Veterans Health Administration, Employer-Provided Health Insurance, COBRA, Private Pay Health Insurance, State Health Insurance for Adults, Indian Health Services Program, or other insurance, which we'd need to write in on the required line item below. Going back to my example with Jimmy, he tells me he does receive health insurance through his employer, and he has no other insurance sources, so I'd select employer-provided health insurance, and then move on to the next question. The last question in this section is optional for any adults who would like to share details about their sexual orientation. There is a caveat that certain funders expect this question to be asked, and those funders include Runaway and Homeless Youth, or RY, Youth Homelessness Demonstration Program, or YHDP, COC-funded Permanent Supportive Housing Programs, or PSH, Unsheltered Special NOFO-funded PSH, and Rural Special NOFO-funded PSH. Really, any of the Permanent Supportive Housing or PSH programs, the expectation is this question is asked to the client, with an additional caveat that if that person does not want to provide that answer, it is okay to document that by selecting refused. And really the intent of asking this question is to better understand and document the disproportionate rate homelessness impacts our LGBTQ communities. If the funding source associated with the project you're collecting data for doesn't require you to ask this question, you can skip it. You can leave it blank, and in HMIS, for whoever's doing the data entry, if it's left blank, the value that gets entered would be data not collected. But for any adults or heads of households who do want to share this information, you'd select whichever option corresponds to the information they provide to you. And if that sexual orientation was different than the options that are listed, you'd select other and enter the details in that required line item provided to you by the client. The next section in the paperwork allows us to document the contact information for the client, and we would select the appropriate contact information types and enter any relevant details below. We intentionally left a lot of space here so you can document multiple phone numbers or email addresses if needed. So for example, let's say that I had both a personal contact and case manager contact I wanted to document. I'd enter in the cell phone number for the client indicating personal cell, and I'd also enter the phone number for the case manager in parentheses, maybe indicating case manager. Same deal for email, personal email address for the client, indicated in parentheses, case manager email, indicated in parentheses there as well. We also have a section in the paperwork that asks clients if they have any address information they'd like to share. And for folks who are entering homelessness prevention projects, they might have a current address that they could share, but it's probably more likely that we will be capturing either a mailing address or the last permanent address or location where a client indicated they were last in stable housing, which really, if we're collecting that last permanent address, it can just be the city and state with no additional need to capture the street address or the zip code. By collecting the city and state associated with where people report being last permanently housed, we can use actual data to push back on harmful narratives like the one about how people moved to Colorado to experience homelessness. By using this data associated with the last permanent address clients have provided to us and had entered into HMIS, we've been able to demonstrate that overwhelmingly, people report being housed in Colorado prior to their experience of homelessness and not elsewhere in the country. Being able to move from anecdotes to data-driven evidence can be quite powerful at pushing back or dispelling these harmful narratives and help us secure additional funding for housing resources right here in Colorado. By collecting that city of the last permanent address info, particularly for folks in Colorado, we're able to analyze where in Colorado they reported being last stably housed as well. And the very last section of our adult intake paperwork is related to those of you who are participating in coordinated entry initiatives. For those of you that are, we'd ask that you indicate your coordinated entry assessment region, the county associated with the coordinated entry work that you're doing, and the coordinated entry bucket that the client is currently in, which for most folks will be assess, especially if the person is having a coordinated entry assessment or VI-SPDAT completed for them at the time of intake or shortly thereafter. If you aren't sure how to complete this section and you're participating in coordinated entry, please reach out to us or the coordinated entry leads in your region who would be happy to help. And that's it. Thank you so much for watching this tutorial and for the important work that you do. I hope everything that we reviewed has been helpful, but I know we reviewed a lot of information, so if you have any questions or concerns, please feel free to email us at dola_bos_HMIS@state.co.us.